Welcome to Talking Feds, a roundtable that brings together prominent former federal officials and special guests for a dynamic discussion of the most important political and legal topics of the day. I'm Harry Littman. With just 2 weeks to go until Donald Trump takes his second presidential oath of office, we continue our series of subject-specific episodes to gear up for Trump 2.0. Our focus today is on health care. Whether or not the U.S. Senate confirms Robert F. Kennedy Jr. as Secretary of Health and Human Services, his nomination alone points to a potential seismic shift in federal health policy under a second Trump administration. Kennedy has idiosyncratic views across a range of healthcare areas, beginning, of course, with vaccines, where he, at a minimum, has entertained non-scientific views, but says he is now not opposed. The chaotic experience of COVID-19 during Trump's first term underscores just how suddenly a healthcare crisis can erupt and dominate an administration's agenda. And setting aside Kennedy's eccentric views, it's far from clear that he has the chops to run the enormous agency with its multiple technical missions. Trump, historically disengaged on healthcare policy, appears ready to hand Kennedy free rein, saying, "I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines," which is exactly what millions of Americans are scared of. To understand what looks to be a coming 180-degree reversal in federal healthcare policy, including a rejection of some of the medical understandings that have informed it for years, and the potential costs in the health and lives of Americans, we have a great roundtable of national experts in the field. And they are Dan Diamond, a national health reporter for the Washington Post, where he focuses on accountability, federal agencies, and public health. He previously covered the Trump administration for Politico, where he won a George Polk Award for investigating political interference in the pandemic response. First time on Talking Feds. Dan, thanks so much for joining.
Harry, first time on, but not a first-time listener, so thank you for having me.
Thank you very much. Dr. Ezekiel Emanuel, who's given me leave to call him Zeke, as most people do. He's an oncologist and world leader, really, in health policy and bioethics. He is the most widely cited bioethicist in history. Some research assistant had to count everybody else, and he's first. He's a special advisor to the Director General of the World Health Organization, senior fellow at the Center for American Progress, member of the Council on Foreign Relations, and a professor at the University of Pennsylvania's Perelman School of Medicine. Zeke, thanks so much for joining.
Nice to be here.
Okay. And not a first-time guest on Talking Feds, Dr. Kavita Patel, a teaching professor of medicine at Stanford University, a board-certified internal medicine physician. She previously worked in the Obama administration as director of policy for the Office of Intergovernmental Affairs and Public Engagement. She's a contributor to NBC News and MSNBC. And you have a regular podcast, no, with Norm Ornstein?
Yes.
Words matter. Yeah. Okay. Thank you so much for joining.
Thanks for having me.
All right. So let's jump into RFK Jr., Donald Trump's pick to lead the $2 trillion Department of Health and Human Services. He presents him, does Trump, as a change agent for the nation's healthcare system. So I guess let's start here. Kavita, you pronounced yourself stunned, and I saw you on TV. You looked stunned when the news came out. In a normal Republican administration, would RFK Jr. be on anyone's list of, say, 50 or 100 possible candidates to lead the HHS? In other words, is he an eccentric choice or a just absolutely wacky one?
Yeah, I'm going to have to go with the wacky one because I actually don't think he realizes the work he has to do. Maybe he does, but the reason I was stunned is I thought, surely he'll be an advisor in the White House. He can kind of come and go, doesn't have to disclose as many of the conflicts, can do things on his own. be able to kind of be MAHA, whatever he wanted to be. But, being secretary, like he has some responsibility and actually has things that he has to do. And it never struck me that was in his wheelhouse. So I was stunned, and I do think it's wacky. And I think the wackiness has just followed all the other appointments since then.
Yeah, well, that's an interesting, Dan, let me turn to you on this, because I think what Kavita is emphasizing is this sort of, he has many different personalities and past, but one of them is this sort of dilettante, Kennedy washout. He's been all these different figures, and we know him only on a top level of maybe an anti-vaccine guy. He says he's not. I wonder, as you're sort of anticipating the potential confirmation hearings, what's the best description of who RFK Jr. actually is today and what he truly stands for?
Well, Harry, RFK Jr. has said that he had a wild and rambunctious youth. It just ended at age 60. So he is someone who has, by his own admission, lots of skeletons in his closet. Some of those skeletons have come out in the press and been reported on by my colleagues and other outlets too. I've been on Capitol Hill this past week trying to ask senators, is this guy going to get confirmed or not? And it's very murky. He has stances that have alienated Republicans. He has been a supporter of abortion access in the past. He's talked about reforming agricultural practices. There are a lot of senators in the heartland who are nervous about that. And then, of course, there's the vaccine issue, which to me seems like a red line that a lot of Democrats, at least, aren't going to cross. That he's raised these questions about vaccines. He founded a major anti-vaccine group. Kennedy himself has said, I'm not anti-vaccine, I'm just asking questions. But I kind of think, Harry, if he's not anti-vaccine, who is, right? Like if the shoe fits, he's raised as many questions as anybody. So he has other policies. There are things that he has said that many Democrats actually do like, changing how physicians might get paid, taking on the industry, the pharmaceutical industry, the food industry, things that Bernie Sanders and other senators have said to me, like, we like that. But the vaccine issue may be the big one that he just can't get around.
Sticking with that for a moment, what seems to be the big kind of dynamic going into confirmation proceedings, if you have a sense?
I think one challenge with Kennedy is so much is already baked in. He has been a public figure for a long time. And we talked about this when he got nominated. My colleagues and I talked about this. What new revelations could really shake people's opinions of him? And the fact that Donald Trump has been so closely aligned with Robert F. Kennedy Jr., that there's a belief within Trump's orbit that Robert F. Kennedy Jr. helped bring him some important votes, independent votes who might otherwise have gone to Kamala Harris or just sat out the election, that Kennedy is going to retain more support than some other nominees that Trump might have put up. I think the past couple of days, Harry, we did see something instructive, which is a new report on what is generally known that people in Robert F. Kennedy Jr.'s orbit have questioned vaccines, and specifically a polio vaccine. That was enough to move Mitch McConnell from a posture of maybe being quietly skeptical to coming out and saying, I can't support any nominee who is going to put these life-saving vaccines at risk, and McConnell's a polio survivor. So there could be more like that as there continue to be stories about RFK leading up to the confirmation early next year that will move senators from not wanting to comment to the Washington Post to being willing to go on the record and say, we're not going to support someone like this.
Yeah, I mean, I think they have to get a little hinky at the thought that they vote yes and then something terrible happens. Other agencies, people are nominated and they seem to have an inbred hostility. HHS feels pretty different. That is, you bring if he's able to work his will, it's possible that people die, people don't get better, all kinds of things happen. When you think about his prospective tenure, what risks most concern you?
Well, at this very moment, the risk that most concerns me is H5N1. We have a bird flu circulating out there. Whether it's going to blow up and be a real health threat to people or stay in cows and birds, it's done some pretty big damage in birds. Who knows? But being prepared to address an emergency like that is something that I think is worrisome. As soon as later in the spring, the fall, we could have some serious trouble with H5N1. Not predicting it, but there are lots of worrisome signs. You only need a few rearrangements and we're, in trouble. That requires competence in managing things. First of all, the CDC, and we have a congressman who's a doctor, but I don't think a public health expert, and certainly not an epidemiologist or infectious disease expert, slated for CDC, and marshaling all the people for the epidemiology, coordinating with states, bringing in the data, analyzing it, trying to understand what's happening, looking at the genomics, working with the various industry groups to create a vaccine rapidly, deciding, not fighting the COVID battle, but deciding here and now what's the best approach. Those are all really complicated questions. And I guess if you ask me what's the number one thing, that's the number one thing that makes me nervous. A lot of the other stuff, it might be hard to figure out, is this going to hurt someone? Or was it a policy adopted by the Trump administration that ended up hurting people, whether something was approved that shouldn't have been approved or held back that should have been approved and people should have gotten it. So I think that's the one thing which is really would require a lot of sort of skill and talent, and this not being your first rodeo.
Right, which it is, right? I mean, even a favorable view of him, I think, would see him as flighty or a maverick, not a guy to get on top of and control a $2 trillion budget agency.
These nominations, I think, have rattled, as well as lots of comments about getting rid of a lot of federal employees, have rattled a lot of the senior civil servants that you would entrust with helping you run an emergency response like to bird flu. And a lot of them are looking for jobs. I don't think there's any secret about that. And that may deplete the reserve of people with knowledge and previous experience that would be very, very helpful. Now, in the past, Donald Trump has sort of blown that away. Well, we can call people back. Maybe.
It's a really good point, and it dovetails in my little world at DOJ. There's people who are going to be on the street and really others who are demoralized, and that career staff is the heart and soul of the place. There's another way to kind of frame this issue, though, which is conversely, it may be that who's ever left can kind of roll him pretty easily. There was some, there's really the wherewithal in an entrenched staff in HHS to kind of wait him out and do their best to do no harm.
Well, I think, Harry, there are two things happening. First, there are people who might be further along in their careers and are choosing this moment to make an exit. We've seen a number of senior career folks say sayonara. I think that HHS is sprawling in the sense that I'm a reporter who's been covering it for nearly a decade. I'm still learning new things about what HHS does in its purview. There are lots of things that RFK Jr., despite his long career in the public eye, he's never really had to think about. Taking custody of unaccompanied kids at the border, which has been a major HHS priority these past number of years, and submarined in some respects the past couple secretaries. This became a big issue in the Biden and Trump administration. So whatever RFK Jr. wants to do at HHS, as I think Kavita and Zeke were getting to, there are going to be a lot of things he needs to do day to day, and they will draw his attention away from the agenda that he thinks he has going in.
Do we have a sense of whether Trump will sort of be behind him? My sense is that Trump doesn't care that much about this, although the few comments he's made have been harrowing. We're going to let RFK run wild and have fun with this, Bobby, etc. So cavalier about the healthcare results. But as you guys are explaining who he is and what are the challenges, you could see him as kind of just not making his mark and being, and as in every administration, one of the 50% or so who are just kind of not in the news until something hits the fan.
It's such a big position, and he is going to have a lot of power just on his own. If he gets confirmed, I see it unlikely that he would not make some mark in some way. And whether it's simply through using the tools of the government to raise new questions about vaccines or policies that he might pursue, it's a pretty big job. And even if Donald Trump doesn't get involved, Kennedy would be able to do a lot of things with lasting impact.
I agree with that. What I don't see happening, and maybe this is what you were getting at, is this election, healthcare was not a 1, 2, 3, 4, or even a 5 issue. Maybe on drug pricing at some margin, and maybe focused on the PBMs, but I don't see it being a top issue unless something pretty important changes, like H5N1 or some other flaw. I do think, nonetheless, there are things that RFK can do that maybe aren't in the front pages of the papers every day, but can have a big impact. And he's already had an impact. And let's just be clear about it. His position, the fact that we've had someone with his position on vaccines elevated, and let's call it, whether you want to call him an anti-vaxxer or not, he's ambiguous on vaccines and questioning and skeptical of them. We've seen the number of kids getting vaccinated go down. We have seen the number of people taking exemptions at schools go double, basically from 3% to 6% nationwide for various conditions like pertussis, like measles. The number getting vaccines has dropped below the herd immunity threshold. So there's a lot of stuff that can happen even just by his mere presence. And let me give you one other that worries me. Drug companies are constantly facing, where are we going to spend our research nickel? And it's a lot of money they're going to have to do to focus it here or focus it there. And, vaccines are not big profit makers for them by and large. COVID aside, which was sui generis for Moderna and Pfizer in terms of how much they made on it because the whole world got them, they're generally not that big profit centers. And so the risks have gone up with RFK there. We may not get, both approval, or approval will be conditional, or it may take longer. The reimbursement might not happen. We might get our protections for the pool of money to reimburse patients who get injured. All of those raise questions, pile up, and the drug companies say, we're not playing in that sandbox. And I think that's a real worry, because it's like the dog that didn't bark, because we won't know what we don't get. But we may not get a lot. And this is at a moment when, with mRNA and other breakthroughs in vaccines, like for shingles and stuff, there's potential for real improvement.
Let me move on, just because of time. You did throw out the acronym MAHA, Make America Healthy Again. I never heard of that before, and I wonder if it's contrived. I looked into it a little. There seems to be a grab bag, of views about food preparation, maybe alternative medicine, a kind of strange right-wing version of populism. Is that a real thing? And does he represent it? Is this a sort of, movement that within the healthcare world, including consumers, is actually a trend the way MAGA itself would be?
Harry, it's definitely contrived. And I think that there was a conference. I'm not sure if the conference ever came to fruition, but I know several now nominees for running the FDA and other organizations inside of the government were kind of featured in the keynote lineup for that conference. Mark Hyman, also very prominent. By the way, someone who Zeke probably remembers we worked with in the Obama administration, who was constantly trying to kind of improve the quality of food in schools and in other places. So my concern is that, albeit contrived, I have actually talked to a lot of normal people who are kind of outside the beltway, as I like to say, and real people, and they think MAHA resonates. They didn't really attribute it to RFK Jr. They're like, I like that idea of having food that's regulated like Europe.
They have the T-shirts and buttons and stuff.
Right. Why do we have red dye in our food and they don't over there? And then a lot of questions that honestly do deserve answers. And just to be blunt, probably Democrats haven't done enough of a job to say we are trying to deal with those things too. We're not ignoring them. But I do think that it's got the most dangerous, because it's not MAGA, but it is. And yet it gives this you can be MAHA and you can be MAGA adjacent, and somehow that's okay. And it's kind of infiltrated its way into the medical profession, because there are also some prominent doctors, one of whom was a surgeon at Stanford, who are also associated with this movement and who have been all over social media, ripe with misinformation around a number of issues. So all of this is so disturbing, Harry. Regardless of who gets nominated and confirmed, we have now shifted the populace of trust in medicine to be a big question mark in some places. And that's very concerning.
I would say, whether it's contrived or not, the idea that we need to focus on chronic illness is, first, I would say, for many people, not new. And it's True. 85+% of every dollar spent in healthcare is for people with chronic illness. That's the problem. The acute illnesses, breaking your bone, bicycling, or something like that is not what's driving the healthcare cost curve over the top. And so we do have to focus on chronic illnesses. Now, between that idea and actual policy is a big, big gulf. I haven't heard a very specific policy. If you want to think about it a little bit, yes, okay, we should definitely do something about obesity, which is common to a lot of chronic illnesses. The problem is fixing the obesity epidemic in America, where 70% of the adults are either overweight or obese. That's a long-term project. And yes, he's right. You've got to do the food system, etc. But last I looked, and someone can correct me, the Secretary of HHS is not the Secretary of Agriculture, and his control over the food system, other than if it's safe, is pretty minimal. So I think, there's a lot of important wisdom in focusing on chronic illness and the food system, but that doth not make policy. And we do need to have, all right, what are the chronic illnesses we're going to focus on? What are the policies we're going to use to actually get our arms around it, et cetera? And what's the timeline of getting a response from those policies? None of that is simple.
I do think, too, MAHA has succeeded in making, as Kavita was saying, an issue that Democrats historically have been identified with. It has shifted where I'm on the Hill this week talking to Republicans. A year ago, Harry, I was running around Capitol Hill around this time. We were doing a big series on life expectancy at the Washington Post and trying to understand, do senators think this is a problem or not? Lots of Republicans didn't want to talk to me about it.
Really? And they're from states where life expectancy tends to be lower, right?
Yeah, it was an irony where the senators, the Democrats from Massachusetts and the Northeast, and they're very happy to talk about how life expectancy is a problem. But in their backyards, it's much less of an issue than in Alabama. And, I'm standing with Tommy Tuberville a day or two ago, and he's going on about all the problems with our chronic disease and the need to address food. So it has shifted, whether it is contrived or not, whether it's real or not, it has moved the political conversation in a big way.
Well, all right. So that seems pretty constructive. And it's a counterpoint to what you were saying, Kavita, that seems like all the ideas are disastrous. On the sort of, even a broken clock works twice a day, we associate him so much with an anti-vaccine movement, whether it should be, as Zeke says, 80% or 100%. And that's, I think, dubious and dangerous, as many people have counseled. What are the other ideas that he, brings to the table if he's confirmed, or, into popular conversation that are maybe a good thing? And do you see any other sort of silver linings in the Kennedy nomination and the sense of kind of shaking up in Trumpian fashion the government healthcare regulatory system?
I do think that I kind of see the nominees around him, just because, as Dan, I think you covered this, we know that there was a bit of a litmus test. Anybody who was nominated for NIH, FDA, they all met with RFK Jr. at Mar-a-Lago. So there was a clear, kissing of mutual rings, per se. And I do think that through the nominees and this kind of galaxy that they've created around RFK, you're going to see some changes that are probably long overdue. I'll say at the FDA, for example, a former colleague of mine, Marty Macri, is nominated. I'm actually a big professional and personal fan of his. He really wants to come in and think about speed of drug regulation and trying to find some equipoise there. He wants to put some gas on thinking about artificial intelligence. I don't think those are bad things. And then he wants to remind people that there's an F in FDA, and getting back to food. I think that does get back to kind of the RFK Jr. mandate. So I do think that not all things are bad and that there are some good ideas. But Harry, it's all about execution. And if your top government career people are going away, if some of the, we just saw the deputy commissioner of the FDA put in her resignation, I expected that. But if you start to see some of the top talent leave as a result of it, what are you going to do? How do you get your job done? And that's the hard part.
And it's a cross-cutting problem in the federal government, let's just say, again, in my world, too.
Yeah, I think one thing that Dan mentioned that RFK has expressed some interest in relates to physician payment. As someone who has worked in that area and long time called for reform, I think he's onto something, which is, again, we pay in a cockamamie way that ends up paying a lot higher to surgeons and other doctors who do procedures than we do to people who do primary care. And his point is we shouldn't be doing that. Primary care is important. And second of all, a lot of the input that goes into those, how you produce those payment formulas, come from the AMA, something called the AMA's RUC, their RVU utilization revision committee. And that, he says is wrong. And I think both of those things are true. And again, just going back to one thing Kavita said, you can have those beliefs, but then you have to execute on them. Having big policy ideas are great. Having the right ones are really important, but you're only going to make a mark if you actually affect change. And that requires knowing how to do and how the government works and what you can do by regulation and what you might need legislation for, et cetera, et cetera.
Yeah, it seems like a very heavy lift for him. But a lot of that in my limited government experience has to do with who are your second and maybe third and fourth, but, deputy will matter a lot. Let me stick with this idea and with vaccines, just because that's what everyone's thinking about. And again, sort of turn it around a little, and you might have the best sense of this, Dan. So he comes in the first day, and guess what? He's really is anti-vaccine, and let's do everything we can. Gathers people around the table. What is sort of between his ardent endorsement of it and the actual change in the country? Because it's my sense that the bureaucratic hoops are dizzying and many.
Well, I would just be speculating, which is always dangerous for a reporter. But we have done some reporting on all of the different levers that an HHS secretary could pull starting on day one. And RFK Jr. has said he wants to do more data reviews of vaccines that have already been approved and potentially new ones that are coming. So we could see something like that very quickly.
Yeah, that you can just do. You can order up right away. Yeah, okay.
More or less. I mean, there are different things he could do. He could say that he's calling together a panel of independent advisors. He could dispatch people at the agencies to do more research. There are things he could do in that vein. He also would have some power to appoint experts to the various committees that make federal recommendations. And I don't know if Kavita or Zeke have served on these panels. I'm sure they know people who have. But it's my understanding that right now this is a pretty representative mix of experts who believe in the benefits of vaccines. RFK Jr. could put experts who are skeptical of vaccines onto those committees. And the recommendations that follow could be very different than what we've seen in the past. Those aren't necessarily binding. States, local leaders have wherewithal to go their own way, but it could be very confusing where the federal government is suddenly saying, administer these vaccines at a different time, or maybe don't administer certain vaccines, and people on the ground are trying to make sense of it, or trying to get reimbursement for vaccines that the federal government is now raising questions about. So that could all be confounding. And then Harry, I think Zeke was the one mentioning this earlier about bird flu. There inevitably is going to be some public health crisis. There are going to be new vaccines coming the next few years, even just for flu. You could see an RFK Jr.-led agency just slow walking some of that, making it harder for some of those vaccines to get approved quickly, holding off on inspecting the plants even, which is like a necessary step. So a lot of different tactics he could unveil. I will say that Donald Trump has seemed to draw a line around at least the polio vaccine. Donald Trump has said in multiple interviews he believes that the polio vaccine has saved lives. We got the vaccine. Polio in America went away. It'd be very hard to convince him otherwise. So that vaccine and potentially some others, you could see Donald Trump pushing back on something that RFK Jr. might want to do.
All right, let's move to a couple other big ticket items. Kavita, you mentioned you and Zeke working in the Obama administration, including on the ACA. Do you see it at risk in the next 4 years?
I don't see the kind of language we had of the repeal and replace, kind of at that beginning of the first Trump having any ground whatsoever. However, in the first administration, he skinnied down, kind of took away like navigator services and put into place like junk plans. Before, you had to have kind of benefits that were at least meeting what we called essential health benefits, mental health care, cancer care, et cetera. And basically, Trump introduced the ability to have what we would call skinny plans that don't necessarily have those essential benefits. They're cheaper because they do not have all of those essential health benefits, but they also don't provide, for example, for mental health care or cancer care. So they dupe the public into thinking they got something cheaper and maybe got adequate health care when they didn't. And I can see him doing all of that again. And then the biggest issue is that the subsidies for the ACA are on the renewal block right now. And I don't see Donald Trump or a Congress of this composition fighting for those subsidies. So I think that there's a lot that can take away some pretty important elements of the ACA. And then a lot of the ACA is going to stick around. And I'm not as worried about the entire law kind of getting gutted the way people talked about before.
I think there are two things going on here. Let's be very concrete. They have no idea. It's been almost 15 years since the Affordable Care Act was enacted, and they have never once in all of that time proposed anything remotely resembling a replacement package. They have bereft of ideas. And I've said this in large part because the Affordable Care Act is built on very much a Republican chassis. Individual responsibility with subsidies to buy. That's an idea that goes back to Richard Nixon in 1947. So they have come up with nothing different. They talk about, consumers should have more skin in the game. That's not a policy, and nor is it very accurate since they have plenty of skin in the game. And I agree with Kavita. There's no chance the Affordable Care Act is being repealed. In large part, look at every single state where expanding Medicaid as part of the Affordable Care Act has been on the ballot. All of them red states, Idaho, South Dakota, Missouri, Oklahoma, they've all passed. Republicans want the coverage. Okay, it's not going to happen. And that's why repeal is never going to happen, because there are plenty of Republican senators who know that their constituents really want this, whatever they say to pollsters. On the other hand, Kavita's right. There are a variety of things you can do to obstruct and undermine certain provisions of it. I think the bigger problem is they're facing two big threats. One is we've had 15 years, maybe even a little more, of flat healthcare expenditures. We're at 17.5% of GDP. That's where we were when we passed the Affordable Care Act. It hasn't gone up except for 1 year during COVID. But now we're seeing that this last year it's gone up. Next year it's projected to go up even more. That's going to put a lot of pressure on them because they're going to have to say, and Donald Trump has pledged, I'm going to reduce your healthcare bills. Well, show me, because I don't think he has a plan. And I don't see that Dr. Oz or anyone else who he's appointing is going to have a plan either. So that's going to be trouble. There are things you can do, but I don't know that it's things they're going to do or things that they've thought through. How does this play out? And I think the public is going to be pissed about that. Whatever you want to say about Luigi Mangione, he clearly is a figure who's gotten a lot of, I regret to say it, a lot of vigilantism out there about insurance, medical system, etc. It's very close to the surface. And if healthcare costs keep going up and some people die or some people go into debt and they get the kind of attention needed, this could blow up in their face. So I think that's something they're not paying attention to. The other thing is if healthcare inflation goes up really rapidly, the date at which Medicare will become bankrupt will actually move in. And that could be a real albatross on them. They let Medicare go bankrupt, factually, but it might require some trimming of Medicare benefits, and they may like that, but their voters won't like it. So I think those two threats are something we haven't heard anything about, but they're real, and they're the kind of thing that you need, again, people who've got experience, people who've thought through policies, ready with ideas as to how we might address them today before they become, big public issues on the front page with Dan Diamond reporting in the Washington Post.
I mean, it's a really great point. It strikes me healthcare in particular is the kind of field where shit happens and it's not what you think it's going to be. I did want to ask, it took me by surprise, and I did find it appalling, the kind of swashbuckling romantic image that a lot of people have for Mangione. Does that accord with your sense of the popular resentment of the healthcare industry? Were you sort of surprised? That's some pretty wild stuff.
A vigilante assassination is not something that should be praised. That's morally reprehensible, and people should be ashamed if they praise it. That it expresses dissatisfaction and, importantly, frustration. I don't know what the hell to do with this system. I can't, get my calls answered, etc. Yesterday, I spent 5 minutes on the phone waiting at to call a doctor's office, cancel my appointment so they wouldn't hold it and they could give it to someone else. 5 minutes. I'm doing them a favor. What the hell?
No good deed goes unpunished, right?
And if you look at the polling, like a week before Gioni or something, the Gallup released a poll that shows frustration with the system is higher than it's been. And the idea that it needs major reform or is completely broken is also higher than it's ever been. There's a lot there. And again, I don't know of any politician who fully understands we have deep structural problems, and another No Surprises Act, or maybe now we'll do something with prior authorization and maybe PBM. That's not going to do it. It's not going to solve your problem. It's not going to get people frustration down, and you're going to need much bigger, more structural reforms, and they haven't even thought about it.
Yeah, I mean, the only thing I can say in addition, I agree with everything Zeke said. I knew Brian Thompson, the man that was murdered. I bet Zeke did too. He's a prominent figure in Medicare Advantage insurance. And so what I will say is, like, the only thing I'm shocked by is how stupid the response has been from kind of, Congress, like policymakers. People are like, oh, I mean, this is incredible. We need to look at this. And I'm like, really? Like utilization management, prior authorization, all these things that we've been talking about is just stupid kind of machetes in healthcare are a problem. Now you realize it. It's just it's a little troubling, Harry, that it takes this to kind of put a spotlight on something that has just become, fungal in nature and not in a good way.
Yeah, I'm trying to think in a normal person's life, that experience that Zeke just described, which you were doing a good deed and you were doing 5 minutes. Some people do, have to, and it's 3 hours and it's frustrating. There's nothing quite like it. There's nothing quite like the DMV, but that's once every 3 years, whatever.
Harry, the one thing that was a little bit surprising in kind of a bad way, but then I realized not so surprising, Zeke, is that, all the outlash from doctors. There were so many doctors that kind of roiled in on social media that were got what they deserve. There's just such anger. When you have an environment where the people who are giving the care and receiving the care all hate it, but you're still racking up, United is that big elephant in the room. And what are you going to do about it? And smaller insurance players can't even get in to kind of break through that, what feels to me like a monopoly. I'm not an FTC chair, but there you go. That's what was surprising.
All right, it is now time for a spirited debate brought to you by our sponsor, Total Wine and More. Each episode, you'll be hearing an expert talk about the pros and cons of a particular issue in the world of wine, spirit, and beverages.
Thank you, Harry. In today's spirited debate, we unpeel the truth about Pinot Noirs to see where the grapes shine best, Willamette Valley in Oregon or Burgundy, France. Here in the U.S., we classify our New World wines by the grape. Old World wines, like those in Europe, are classified by the region. In France, Burgundy is not only the region where Pinot Noir wines are from, but it's also the Pinot's ancestral home. No pressure, Oregon. To level set, Pinot Noir is a thin-skinned grape, which makes it difficult to grow, especially in warmer climates. Burgundy happens to have a cooler climate with ample cloud cover, making it the perfect home for Pinots. The cooler temperature allows the wines to ripen longer, giving the grapes extra time to develop more complex flavors like strawberry and dark berries to black tea and earthy minerality. Burgundy produces Pinot Noirs that are full of aromas and nuances. If we hop across the pond, we have Pinots from Willamette Valley in Oregon with similar cloud cover, climate, and soil composition as Burgundy. Oregon produces smooth and fruity wines that are slightly earthy and most definitely tasty, giving the region of Burgundy a run for its money. You can find all of these at Total Wine and More, where we have a huge selection of Pinot Noirs from Oregon to Burgundy, plus wines from every region in between. All that's left now is to reach up to our shelves and pluck one out for yourself.
Thanks to our friends at Total Wine and More for today's A Spirited Debate. Let's spend a couple minutes on abortion to the extent it falls under some cabinet's purview, could well be his. State the obvious, Trump's been all over the map, but he's going to face concrete pressure, I think, now, and he won't just be able to parry it. He'll have to sort of come down one way or another on some kind of federal policy. Do you have a sense of either Trump or RFK Jr. and what if it's going to be a contentious policy issue under Trump?
Well, can I ask Dan, did this come up in the Hill visits? Because I have been curious, like how this is resonating with lawmakers as he's walking around. It's the one area where I know some Republicans have had pause with RFK Jr.
They have been asking him about it, and so far RFK's been giving them answers that they seem to like. So RFK had said during his presidential campaign a bunch of things about abortion, including at one point that he basically supported abortion access up until viability, which is very much not the Republican position. But he has met with pro-life senators who have walked out, like Tuberville, like Hawley, who have said, we think his answers on abortion are good, that he's in line with Trump. I think Josh Hawley even said he might pursue a crackdown on mifepristone. I think what's tricky is that RFK Jr. seems to be the kind of guy who says very different things to different crowds. He will say one thing to the vaccine skeptics he might speak to about his own concerns about vaccines. But then when he meets with senators, tells them he's not so worried. Or, he said to reporters this week, he supports the polio vaccine. So he may be seeing these things right now ahead of confirmation. I don't think that necessarily locks in what he would do if he gets into this role.
It sounds like there's really a pretty strong consensus in the medical establishment that, this is not eccentric, but wacky. Is there any kind of role that you see the medical industry or any other sort of professionals playing in the confirmation? Do you know of any kinds of moves afoot to try to push back from a professional vantage point on the nomination?
Yeah, but the playbook that I would have used before 2024 does not apply. So almost every professional organization has already put out statements that they're against the nomination. They're against the sentiments that call into question vaccines, et cetera. But Harry, nobody cares. The things we would have done in 08, 12, 16, 20, none of those things apply because it feels like it's a new kind of order around influence, traditional anything, advocacy coalitions, patient groups, even blowing up the RUC, that kind of resource utilization committee like that Zeke mentioned. I mean, in previous days, we would never cross the American Medical Association. So on one hand, I'm kind of happy to see some disruption of status quo. But on the other hand, that means status quo is not going to have much of an effect.
And so it sounds like both of you guys agree. Yeah, there is this weird, I'm seeing this again in my world where things that seem so clearly third rail events are just matters of indifference. You feel like you're screaming at the bottom of the coal mine. Who will be the sort of key senator players, and in particular, if opposition coalesces, who would be spearheading it? Do you have a sense?
I don't think Bernie Sanders is going to be leading the charge here, in part because he agrees with RFK Jr. on some of his ideas. On food policy, RFK Jr. and Bernie Sanders aren't so far apart on some of the taking on the industry language. The nomination, Harry, is going to run through the Senate Finance Committee, so that's where I would look first. And there may be a different roster of Democrats on that committee next year, but right now you're looking at people like Elizabeth Warren, like Ron Wyden, who's the current chair and is set to be the top Democrat, who have been pretty critical in the past of efforts to undermine vaccines, and Wyden has been outspoken already. So that's one place I'd look. And then if it makes it to the Senate floor, Patty Murray, a pretty prominent Democrat, has called RFK a crackpot, essentially, over and over again. Other Democrats more favorable and maybe trying to hold some of their fire in a world where RFK Jr. gets confirmed and they might need to work with him. So it kind of depends on the Democrat and what state they're in. But many Democrats, I think, could emerge as big critics of him.
All right. Everyone's been really, balanced and rational in response here, including some of the good things. I want to end with just going around the horn and, you can give me a number, you can give me an adjective, but What is your personal freak out? When I look at my little world, it is friggin' high, but the constitutional structure is different as it pertains to healthcare policy. Just give us, 15 seconds on how worried you are.
I'm worried enough. I seriously looked into citizenship in Portugal and have been trying to think like how much of my class can I teach from another country? And I'm not kidding. It's that bad, and I just don't want to be around it.
Because of the diminution of healthcare services?
All of it. All of it, including I don't know if I can witness all of this and just stay sane.
Well, I'm trying to take this with an open mind because I'm going to be covering these folks. But I will say something like taking fluoride out of the water, that's something I'm thinking deeply about and worried about, because we have a toddler who hates getting his teeth brushed. So if we're not able to brush his teeth and there's no fluoride in the water, are we consigning him to a life of crumbling teeth later? So I think there are real reasons to be concerned, and I'm trying to approach this fairly, but also from the perspective of someone who's covered public health for a long time and hears from people every day who are worried.
Yeah. An important point is later. Some of these things, if they're really debacles, we won't know fully for 20 years. Last word to Dr. Ezekiel Emanuel.
The world's in a very topsy-turvy moment, not just healthcare in America. You've got the war in Ukraine, you've got the Middle East, you've got China, you've got a lot of other issues floating around, what to do about immigration. And all of that makes me nervous, especially because this is an administration which, as Kavita says, doesn't really care about norms. But also, I think in some overall scheme doesn't have a strategy. Yes, they want to blow up things. They want to get retribution for people who they think have crossed them. But that's not a policy to address all these issues. We're in a dangerous moment in world history. And one of the problems, I think, is a lot of what Donald Trump has done in the past is more transactional than strategic. And I think this is a moment where we need strategic rather than transactional.
One more check in my world. Thank you so much, Zeke, Dan, and Kavita. We'll be, biting our nails and watching it along with you and see what transpires. Thank you so much, Dan, Zeke, and Kavita. And thank you very much, listeners, for tuning in to Talking Feds. If you like what you've heard, please tell a friend to subscribe to us on Apple Podcasts or wherever they get their podcasts. And please take a moment to rate and review this podcast. You can also subscribe to us on YouTube, where we are posting full episodes, talking books, and bonus video content. And Talking Feds is now on Substack. Check us out at Talking Feds Substack, where I'll be posting 2 or 3 bulletins a week, trying to break down the various threats to constitutional norms and the rule of law that are coming our way. You can follow us on Twitter at Talking Feds Pod, and you can look to see our latest offerings on Patreon. Talking Feds is a completely independent production, so if you like the work we do and are inclined to support the show, joining our Patreon is the best way to do it. Thanks for tuning in, and don't worry, as long as you need answers, the Feds will keep talking. Talking Feds is produced by Catherine Devine. Our associate producer is Becca Havian. Sound engineering by Matt McArdle. Rosie Dawn Griffin, David Lieberman, Hamza Mahadranathan, Emma Maynard, and Hallie Necker are our contributing writers. Production assistance by Akshaj Turbailu, Genesis Magpayo, and Sebastian Navarro. Our music is by the amazing Philip Glass. Talking Feds is a production of Delito LLC. I'm Harry Littman. Talk to you later.